and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. I'm Colin Hung, and I'm about to sit down with Anthony Villanueva, who is the CIO at Neighborhood Health, an FQHC located in Nashville, Tennessee. I'm really excited because Anthony is doing some really incredible things with street medicine. And using NextGen's mobile application, they are literally bringing care to the streets of Nashville. I think you're going to be very impressed with what he's been able to do with the technology that he's been able to arm his physicians with.
Hello, my name is Tony Villanueva, and I serve as CIO for Neighborhood Health in Nashville, Tennessee. We are an FQHC that serves about 30,000 patients a year with 55 plus clinicians. Being an FQHC, we provide primary care services in medical, dental, behavioral health, as well as specialty services in OB, pediatrics care, and many others. In March of 2020, when the COVID-19 pandemic hit our country, we were impacted with one of our biggest services that serve 5,000 patients a year, with that being our homeless or those patients experiencing homeless, and services that were being provided at a homeless mission as well as a brick and mortar downtown clinic we have in Nashville. As we all know, during the pandemic, we had to close those clinics, and this left a very big absence of accessible services for several of the homeless communities that were in Nashville. Also, with Nashville being a very trendy city and much of the cost of living being raised astronomically, there has been a very big increase in those experiencing homelessness in the city of Nashville. So in March of 2020, we knew that there was something that we needed to do to continue to provide these healthcare services, and the way to do that was actually going to where they are. We put together a program following several of the processes and workflow that we have within our electronic health record for those homeless services in the brick and mortar buildings, but then applied those to be able to go out into those encampments and those places of where there were large pockets of those in those homeless populations, and then provide those services. We worked together with several funding sources because obviously there's the problem, well, how can we fund a service such as this, and being able to get out in the community and do it. First of all, we've taken a lot of the data that we've had with our homeless services population, and which many of you may find surprising, is many of those patients actually had some kind of coverage in the upwards to 30 to 35%, whether it would be Medicaid, Medicare, or even some commercially insured patients. With us being an FQHC, that almost aligns with the exact payer mix that we have as in our brick and mortar clinics. So taking that data and actually going out to several of the MCOs, we were able to sustain several grants from those payer sources to help us kick off and start this program, including equipment that would be needed, such as a Jeep that can go into areas that were harder to reach. So starting this program, as we all know, during that time, PPE was required, some of it looking full body PPE, and it was not really practical to go out with a laptop and carry those things out into the field along with all of the medical equipment to be able to provide those services in the field. So in the advent of such of the technology that has come out with mobile, we've been able to leverage several of those mobile technologies to go out. Advantages to mobile are, again, it's not a laptop that has to have a battery charged, has to have good connectivity, and stay on all the time to be able to document those services. With a mobile phone, you can carry that. Charges usually will last most of the day, and even several of the mobile technologies out there, which I'm about to speak to, don't even require an active cellular signal to be able to document your services. So the particular solution we went with was a product named NextGen Mobile, What this product does allow is simple features that you would expect, like e-prescribing and charge entry and some of those types of things, but it also provides a capability to take pictures securely, send those back to your front office, and some of those types of functions that can help capture and fully document a chart, or at least get it to a point where if there's some follow-up documentation that's needed, it's not going to be burdensome for a provider back at the office. So talking a little bit about our workflow, we first of all use a mobile technology that many other health systems are using, but it's the ability for a patient to self-schedule themselves. However, we take our clinical care teams consist of a patient navigator, medical assistant, clinician, and an administrator that helps kind of guide the process throughout the day. That patient navigator will carry a LTE-enabled tablet and can register the patient, actually being the first point of contact that a patient may see when we're out at an encampment or whatever location we are working with that particular day. That patient navigator can key in the information. It immediately will show up as an appointment encounter in the chart, and then allow a clinician to fully document on an encounter that's attached to the patient. In the meantime, that patient navigator can also put together inside discrete fields the necessary information to allow someone working with our street medicine administrator to verify patient information, even including what I spoke to earlier, eligibility, as a very important step because this patient may have coverage, as well as a very big patient risk factor of making sure that the patient that actually we created to the appointment is actually the patient of record that's in our system. If they identify some issues from that standpoint, they can do a patient merge within our NextGen Healthcare EHR and put those patient records together, create an encounter, and have that ready for the clinician when they're out in the field. Then we also leverage for mobile technology a virtual scribe option that NextGen Mobile as well provides. While a clinician conducts a visit, they can dictate into their phone and, in essence, almost complete the entire visit from just that dictation. The virtual scribe will take the dictation and document as much as possible with what is said by the clinician into the chart, and that encounter is already there based off of the work that was originally done when the appointment and the encounter were created. The clinicians and scribes with our model and with NextGen Mobile tend to develop a relationship. So as time passes, that clinician and virtual scribe that's there will start to learn a language that they can speak to each other and help even make a chart more complete by the time that the visit is over. It is a very chaotic day-to-day for our clinicians. Someday they may just see 15 patients, but then we've seen days where they've seen in the upwards of the upper 30s to maybe even 40 patients, I think we have seen. Those patients could be everything from wound care to chronic disease management, to things like smoking cessation and some of those things. And as we all know, there, especially with the day in our society, sometimes behavioral health issues are also have to be managed. So, which again leads to another opportunity with the mobile platform and telehealth technologies that have occurred. We could connect a patient with a behavioral health consultant within our organization and also provide that support and services for behavioral health care. Our ultimate goal, again, is to not have technology get in the way, but to enable our wonderful clinicians that do the work they do out in the streets to provide those services. And with a technology such as NextGen Mobile and telehealth in combination with patient self-scheduling technology, we're able to at least try to minimize the burden of documenting those visits with each of our clinicians. Yes, you can find name of our organization is Neighborhood Health. We are based out of Nashville, Tennessee, and you can find more information at www.neighborhoodhealth.org.
Hey, I want to thank Anthony for coming on the program with me and for giving us that inside view of how he is using mobile technology to literally bring care to the streets of Nashville. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.